Welcome to this Whole Life Action Hour. I am Ocean Robbins, your host, and we are going to be joined today by Dr. Rajiv Bajekal, who is a fantastic spinal surgeon and lifestyle medicine practitioner. We're going to be looking at how a whole food plant-based diet and lifestyle can help reduce inflammation, build stronger bones, improve joint health, and create a better quality of life for you. Now, let me ask you, are you suffering right now from any back or bone or joint pain? Do you have an interest in preventing these debilitating health conditions or improving your musculoskeletal health or taking action steps to prevent osteoporosis or reverse it if you already have some? If any of this is true, or if you're just curious or interested, you are in the right place. Now, I want to be very clear. Nothing you hear today is medical advice. This is coaching. We're sharing our best insights, but of course, always consult with a qualified healthcare professional for your specific medical issues and needs. That said, you're going to learn a lot today. This is a project of Whole Life Club, which is Food Revolution Network's ongoing membership community. And some of the questions that I will be bringing to this interview come from our Whole Life Club members. Now, Dr. Bajekal is a consultant spinal surgeon and pain specialist with a keen interest in managing spinal stenosis, osteoporotic fractures, and infections using non-surgical solutions and lifestyle medicine. He practices in London at the National Health Services at the Royal Free Hospital, and he also practices privately at multiple Central and North London hospitals. He is a board-certified lifestyle medicine practitioner who has personally experienced the healing benefits of a whole foods and plant-based diet, and he has become a passionate advocate of lifestyle medicine with his patients. Dr. Bajekal, thank you so much for joining us today.
Absolute pleasure, Ocean. Good to see you today.
It's so good to see you. Now, I want to start off a little bit personally, because I know you've experienced the benefits of dietary and lifestyle changes in your own life. Can you tell us a little bit about that and how it's impacted your life?
Yes, I think there were a combination of factors that led to my health deteriorating. But I came to the United Kingdom, to London in 1992. And I think a combination of the stresses of working as a surgeon, as a junior doctor first, irregular eating habits, terribly irregular sleeping habits, but also quite a lot of fast foods on the run. A standard lunch would be, for instance, a sandwich, a Coke, a Coca-Cola, and a packet of chips. And that would be on the run. You hardly even had time to sit down and eat. And I think all this led to me putting on some excess amounts of weight. So I came here with a weight of about 150 pounds, around 70 odd kilograms. And gradually I felt it was piling on. And I didn't seem to have an answer to it. So about 5 years ago, one of my friends, a colleague in the orthopedic department I work in, decided for his 50th birthday, he would make us all a little bit fitter. And so we started cycling, we started doing quite a lot. I went on to a pretty radical diet with a very low caloric intake. And I lost quite a lot of weight, but in fact, my diabetic markers got worse. So things came to a head in December 2016. I was driving, my wife and I were going to an evening dinner engagement somewhere in London. And I was beginning to have the effects. My vision was deteriorating and I was just a little bit unaware of it. But that particular evening, it was in December around Christmas time, and I nearly crashed into a lamppost. And at that dinner event, I found a surgeon, a previous ophthalmic surgeon, who looked into my eye and said, I think you've got cataracts in both eyes. And at that time, I also had a frozen shoulder. I knew my diabetic markers were creeping up. I had pre-diabetes for sure. And this was really the lowest point I've been at, and eventually had to get my cataracts operated in both eyes. I felt that was really a revelation that, I didn't realize diabetes would just suddenly creep up on you. I had a strong family history, so I suspected it was down to that. Like most other doctors at that point, I had very little knowledge about nutrition, about the kind of foods that heal rather than harm you. But after my cataract surgery was done, I was sitting down and flicking through Netflix, because suddenly I could see television much more clearly. And I chanced upon Forks Over Knives on Netflix. And I watched the whole film. At that stage, I was actually pescatarian. So I was eating some fish, a little bit of dairy. I'd stopped eating most other animal products in 1996. My wife had become an ethical vegan at that stage, but I resisted it for a variety of reasons, which I now regret. But when I saw this film, by which stage I'd actually already, because of my healthier exercise habits, lost about 30 pounds of weight. When I saw this film, I suddenly realized that my diabetes could be improved by this. And so I converted overnight, literally, to a whole food plant-based diet. And I shed another 20 odd pounds. So overall, I've shed 30 kilograms of excess weight, well over 60 pounds. And it's made a huge difference to my health. So after that, I felt, well, this is anecdotal, it's just one person experiencing the benefits, so why not scale it up? My wife and I both decided we'd do the American College of Lifestyle Medicine diploma qualification, because we could then authoritatively talk to our patients about it, because otherwise doctors, as I said to you, know very little about nutrition. And really, unless we educated ourselves, we were in no position to scale this up and talk to our patients. So that was 5 years ago. 4 years ago, we qualified and we got this diploma, which I've used passionately in my work. And I think it makes me a better doctor, a better surgeon, because I can offer choices. So I don't just have to operate on people. I can tell them, I can meet them halfway. If they adopt a healthier diet and lifestyle, they may not even need the big operations that are quite risky on the spine. And patients are happy to do that. So I feel happier that I'm providing a better service to my patients.
Well, that's beautiful. And you've walked the talk and you've lived it, and so many doctors, it's very hard to speak with credibility about diet and lifestyle when they themselves are really unhealthy. And of course, the medical system pushes doctors so hard, in residency. Famously, aspiring doctors are sleeping 4 hours a night, right? And loaded up with the fastest calories they can pile in at enormous cost to their long-term health. And then they're supposed to teach their patients how to be healthy. Obviously, that's not the point of the system. The point of the system is to treat the symptoms of disease. And that's important. Sometimes we need to treat diseases, but an ounce of prevention is worth a ton of cure. And you're learning, obviously, how to preach and teach that to other people. So thank you for that. I want to dive in a little bit more on osteopenia and osteoporosis. What are some of the best practices for preventing these conditions? And once they've been diagnosed, is there any hope for improvement or reversal?
Thank you, Ocean. Yes. The first thing is osteopenia and even osteoporosis are, strictly speaking, not diseases. I mean, the first misconception a lot of people have, there's a fear element when these terms are bandied about, and people think it's the end of the world if they have osteopenia or osteoporosis. Osteopenia is, in fact, just like the condition I had initially, which was pre-diabetes. You can either keep descending down that slippery slope and eventually get osteoporosis, or you can reverse it at that stage. It's easier to reverse osteopenia than it is to reverse osteoporosis. The important thing is both these conditions are really not painful or dangerous, except when you get a fracture, and that can be dangerous. So the usual common description of a fragility fracture or an osteoporotic fracture is a fracture that breaks one of your bones when you fall from standing height. So in other words, relatively minor injuries, one that most people wouldn't get a fracture from. So osteopenia is reversible. The problem with this whole condition is that we should first of all see a qualified medical practitioner who can make a diagnosis. Is it primary or secondary osteoporosis or osteopenia? So when we talk about primary osteopenia or osteoporosis, the commonest causes are postmenopausal osteoporosis, which occurs in quite a lot of women when they stop having the estrogenic stimulus to their bones. So around the time of menopause, when as much as 3 to 5% of the entire bone volume or stock disappears during the years of menopause. The other kind is senile osteoporosis, which occurs just as a result of aging and the decreased activity that a lot of people experience around as we get older. There are other causes, though, which are eminently treatable. So those are secondary osteoporosis, and often there's either an endocrine element or there's some underlying disorder that has caused it, or sometimes the drugs that we take, steroids, for instance, corticosteroids, taken for a period of time for a lot of inflammatory chronic disorders that we have, can result in osteoporosis. And obviously, those need to be diagnosed, and the factor that's actually causing the osteoporosis should be removed. The important thing about reversing osteopenia of a primary origin, which is, in other words, a naturally occurring cause due to either a hormonal imbalance around the menopause, is first of all not to get it. So for that, really to start early in life. And we can all see that we've become quite a society that actually sits around a lot. We're not as active as we used to be. And for that, in part, I think it's just the nature of the work we do. I mean, human beings evolved from being gatherers and hunters in the African savanna to, within a few thousand years, a million years, we've actually seated at a desk most of the time in front of a computer and doing very little exercise. So I think it's a teamwork issue, the fact that our dietary excesses and inappropriate diets, so eating a lot of junk food, highly processed foods, and foods of animal origin, which I don't think are particularly good for the bones, as well as not exercising anywhere near enough, is what results in osteopenia and osteoporosis. If you catch it early, before you get a fracture, there's in fact plenty of things that you can do to strengthen your bones. So eating a whole food plant-based diet, which is excellent for bone formation. And if you get it early, when you're still in the phase of forming bone, because after the age of 30 to 35, there's a gradual decrease in bone stock. But that is the case with so many other conditions. So you can reverse even this. So a combination of a healthy diet, a whole food plant-based diet, I would say, with possibly 2 portions of soya a day. Soya is a really good food for bones. That together with a combination of multi-component exercise, so which builds in some amount of resistance training or some stimulus to bone. So by multi-component, I mean not just doing 1 or 2 things, but doing different exercises. So star jumps, burpees, skipping, running, wearing a weighted jacket, for instance, a lead jacket or a weighted wristband or ankle weights, and going for a longer walk, even body weight exercises or resistance bands, all these things stimulate your muscles. But by loading bone, it also makes your bone stronger. So even though bone density may not increase, your risks of getting a fracture from osteopenia or osteoporosis reduce very considerably. So it is best to prevent it by building enough of a bone stock, so to speak, or a bone reserve before you get to the age of 30 or 35. But even after, you can still build up your bone stocks by stimulating it and by keeping a healthy BMI rather than being too overweight or too underweight is another good way of really making sure your bones are stimulated adequately.
Okay, so two quick follow-up questions on that. I hear you saying that, I think I heard you say that bone density may not increase with weight-bearing exercise, but bone strength could. Can you explain the difference there? How is it possible that, because bone density is sort of the gold standard for what most people think of for a way of assessing their bone strength, but it sounds like there's a distinction here. Can you tease that out for us?
Thank you very much. Yes, that's a good question. And again, the gold standard method that we still accept for measuring bone density is a DEXA scan, which a lot of people will be aware of. But it's actually, strictly speaking, not a density measurement. It's not a volumetric analysis. It's in fact a kind of marker as best as we can get it. Now, bone is quite a composite structure, as we know. So it's got collagen fibers, it's got a matrix of protein. 25% of bone, of dry weight of bone, is in fact protein. And then it has a lot of minerals in it. Of course, the Oscar-winning one is calcium, which everybody talks about. But there are a lot of other things that are involved in the bone mineral density effect. But we can strengthen bone without necessarily seeing a dramatic increase in DEXA, as long as we head in the right direction. So year on year, as I said, we tend to lose bone stock after the age of 35, or bone density will decrease generally. So if you don't get a decrease year on year and you keep it similar, or in fact around the same, your bone strength is increasing and your likelihood of getting a fracture is lower.
Okay, thank you. I'm curious, you just mentioned calcium, and that's the big mineral people are talking about with bone health, of course. And we all know, we've all heard it in lots of advertisements, that dairy products are very high in calcium, which they are. But yet, are they associated with stronger bone health and reduced risk of fractures? And what is the role of calcium, and what are the best sources if we want strong bones?
That's a very good question, Ocean, and one that has been debated a lot about. So I think when it comes to calcium, there's little doubt that it is responsible. I mean, 99% of the calcium in our body is held in our bones and our teeth. So there's little doubt that it contributes hugely to the strength of the skeletal structure. But in fact, it has very many other roles in the body, including neuromuscular function, intracellular signaling, and so on. So it's a vital mineral without a doubt. It is, dairy, without a doubt, or cow's milk is a rich source of calcium. There's little doubt about it, because it is, after all, food for a baby cow to grow from a calf to a very large cow in just a few months. So it must have those nutritive elements that are good for that. But when we look at long-term cohort studies, or studies that look longitudinally at whether there's an increase in bone strength, we in fact find that some of the countries that have a higher amount of dairy consumption, in fact, have a higher risk of fractures. Now, these don't necessarily point to causation, but they do generally give us an idea that it may not be the only factor that is responsible. And there are a number of other things that I think are responsible for healthier bones. Now, calcium is a mineral. It is present in planet Earth, so it's present in soil. And we can get it from the same sources that the cows get it, namely from eating green leafy vegetables, of which there are many that are actually quite rich and from which the calcium can be absorbed more readily. So those are the lower oxalate greens, for instance, kale, bok choy, cabbage, and so on are excellent sources of calcium, whereas the higher oxalate greens such as spinach and Swiss chard are not very good sources of calcium. So we can get it from greens. Soya, which I alluded to earlier, is another good source of calcium, even though, in fact, oddly, as a bean, it's rich in phytates and oxalates, both of which tend to inhibit the absorption of calcium. But from soya, our absorption is just as good as it is from cow's milk. So we can obtain calcium from a number of sources, and with a reasonably well-planned diet, and in fact, by eating the colors of the rainbow, literally, you can get a large amount of your calcium. One of your questions was, what is the recommended nutrient intake or recommended daily allowance of calcium? And that was debated quite heavily even by organizations such as the WHO. And Dr. John McDougall had, in fact, in his book on the Start Solution, alluded to this. He had looked at the Bantu women in Africa who went through their entire reproductive life on a largely plant-based diet. And their calcium intake was as low as 450 or 500 milligrams a day. In the United States, of course, the calcium intake that is recommended is 1,200 milligrams a day, a whole lot more than the Bantu women who were having 5 or 6 children throughout their reproductive life and lactating and feeding their babies. And it didn't seem to really put them at a risk of osteoporosis, whereas we know that osteoporosis is much more common in the Western world nowadays. And these are countries that are quite high on the dairy consumption. So it's not certain. I mean, milk is still debatable as to whether it's a great food for bones. I would strongly recommend, in fact, the sources of calcium as we discussed earlier. So some of these oxalate poor greens, as well as soya as a good source, as well as a lot of other beans. Actually, you can get plenty of calcium. It's, I think, important when you're choosing a plant-based alternative milk to see whether they've been fortified with calcium. In the United Kingdom and in Europe in general, organic plant-based milks are not allowed to be fortified with calcium. And the fortification actually doesn't taste any different to standard milk, soy milk, for instance, but it gives you that additional boost in calcium.
Got it. Thank you so much for that. What is the role of vitamin D and vitamin K2 in supporting bone health? And do you suggest that most of us should consider supplementation with each of those?
Thank you. Yes. Vitamin D has an essential role in the absorption of calcium and in bone metabolism. It's, in fact, a lot of people would consider it an evolutionary hormone. When we roamed around without clothes necessarily in sub-Saharan Africa, we made our vitamin D from exposure to UVB light. So ultraviolet B rays, spectrum of around 290 to 320 nanometers, is what really makes vitamin D in our skin from 7-dehydrocholesterol. North of the 40-degree latitude and north of and south of that, we just don't have enough UVB rays, certainly in the winter months. In the United Kingdom, for instance, I think most people supplement their diets, certainly in autumn and winter. And I would suggest that because vitamin D has a very big safety range, it's better to, to just supplement it all year round. And if you're vegan or eating a largely plant-based diet, it's worth supplementing because it has such an important role in bone formation and absorption of calcium. Um, Vitamin K2, on the other hand, is a little more contentious. I don't think the evidence is quite there as yet, but it is important in the carboxylation of a certain protein, which is important for bone formation called osteocalcin. Vitamin K2 is present in a lot of animal foods, but one has to look at certain fermented foods if you're eating largely plant-based to get that. And we can acquire it quite easily from eating sauerkraut, kimchi, there are a variety of good foods. Tempeh is, in fact, not only is it good as a source of protein and calcium, but it also is a good source of getting your vitamin K2. So you can achieve a lot even on a well-planned vegan diet in terms of getting these essential nutrients.
Got it. Thank you. And I will say that I think taking a not massive dose, but a modest dose of vitamin D3 and probably some K2 as well may be beneficial for a lot of people. I tend to suggest even a small amount can be helpful. You don't need to go crazy and have a huge doses of either of these, but and you can get your blood levels checked for vitamin D pretty easily, so you can make sure you're in the appropriate range. And you probably want to be somewhat towards the higher end of the normal range because we're learning more about how the benefits are really there for getting your vitamin D up. With K2, there's no easy way to test, so except how you're feeling. So a small amount may be beneficial. And natto, by the way, is a fermented soy product that has by far the most, but it's a bit of an acquired taste. Not everybody likes it. So if you have even a tablespoon of natto every few days, you got your K2 covered, but a lot of people don't like it too much. So
and kombucha and other fermented foods also very good sources of K2. A little bit irregular, but you're quite right. Natto, of course, consumed so much of it in Japan, very popular in Japan, but still a very good source also.
Yeah, thank you. We're not going to get into medical advice here, of course, but as a practicing physician, you must work with the various medications that are out there for osteoporosis. And in general, do you feel like there are some that are more potentially beneficial and some that are more harmful than others? And could you just shed any quick light on which ones do you tend to use in your practice and which ones do you avoid?
I tend to treat osteopenia and osteoporosis more with a lifestyle approach. So I'd prefer to prevent it. And often people get a diagnosis of that condition when they've had one fracture. So if somebody gets a fracture, let's say of the wrist, they investigated with the DEXA scan. It doesn't come on automatically here in the United Kingdom. It's people who are older in the age group of 70 and above who get it generally as a part of their screening process. And if there's a risk element in their families, for instance, if they have a family history of osteoporosis, probably a 5% higher chance of getting osteoporosis themselves, or if they have risk factors such as an earlier menopause or some other factor, or even just getting a fracture. If they've been smokers, for instance, those are all people who are at higher risk of getting an osteoporotic fracture. So if there's a diagnosis of osteopenia or osteoporosis, I tend to manage them certainly if they haven't had a fracture with a lifestyle approach of helping them with their dietary advice, keeping them at a regular BMI, making sure they get an adequate protein source and stimulating their bones so that they can build it up and prevent these fractures from occurring in the future. Now, if they've already had a fracture or if they've got a high risk of a fracture, and we have a method which anybody can access on the internet, it's called a FRAX score. So FRAX. And that would give you a rough idea of what your chances are of getting a fragility fracture in the next 10 years. And if that number is quite high, and that is usually quite high in people with severe osteoporosis, then I think medication is certainly worth considering. But I think medication should be considered really strongly in people who've had one fracture and who are clearly at a high risk of getting more fractures, because as we know, fracture of the hip, fractures around the hip in elderly people has a mortality of about 20% within the first 6 months to a year. And in fact, that mortality rate is higher for a very considerably long period after. So those are people in whom I would consider a protective drug. There are a number of drugs. So I mean, they usually people refer to them by their trade name. So Reclast, for instance, is a zolendronate infusion that we can have for a year. But these are drugs that basically inhibit the osteoclasts from acting. So just going back a step in bone metabolism, bone formation is under a constant dynamic process. So we have osteoblasts, which produce bone, and osteoclasts, which actually take away bone. Now, one may wonder, why do we need these osteoclasts, which actually are taking away bone? But that has a vital role because the remodeling process is constant. So old bone, which is losing its effectiveness, is often taken away by osteoclasts. So we do need osteoclasts. But a lot of these drugs actually inhibit the osteoclastic activity. So old bone is not taken away. It would be ideal, of course, if we had ways of stimulating osteoblasts, but that is slightly more difficult by using drugs. And in fact, methods such as using exercise or resistance exercises to stimulate osteoblasts are better. But of course, that is difficult in people who are very severely osteoporotic. And in those people who are at a high risk of fractures or recurrent fractures, I think due consideration must be given after some thought and proper investigations. I think using one of these bone protective drugs is really quite useful.
Thank you so much for that. Well, I want to get into a few specific questions from our Whole Life Club members now, and some of these will touch on things we've already discussed about, but it's interesting to still illuminate with specific use cases. So Kirsten said, I broke a vertebrae, L1, 4 years ago and found out that I have rather bad osteoporosis. I'm 64 years old and I've lived as a vegan for more than 40 years. I've taken supplements, calcium, vitamin D, vitamin K2, magnesium, and others for most of those years. My doctor wants me to take medicine or an injection twice a year. What's your recommendation? I'm a skeptic about medicines and don't want to take any at all. I'm slightly underweight. Would it be good to regularly wear a weight vest? I practice a daily 10-minute training program and would love to go for almost daily long walks in nature. Any thoughts for Kirsten?
Yeah, I mean, the first question, which I don't have clarity on, is how did Kirsten actually get this L1 fracture? So obviously, if it was a significant injury, such as falling from quite a height or a road traffic accident or so on, and she was just incidentally found to be osteoporotic, it seems like she's a pretty active lady who's out and about quite a bit. I would, at this stage, probably still, unless the osteoporosis was very severe, and if this L1 compression fracture that she talked about was from a relatively minor fall, I would probably still use lifestyle initially. So a weighted vest, as she suggested, and doing some other simple exercises that stimulated her osteoblasts, namely using a whole body vibration exercise at a higher frequency but lower amplitude. So in other words, we didn't make a bounce about too much, but did enough to give that, it's called a piezoelectric effect on the osteoblasts to stimulate them and forming bone. But I think the question as to whether she should go on to medication is best answered by her own physician or whoever is treating her, because they must have a clearer idea of how severe her osteoporosis is and how underweight she is. One of the things that concerned me about Kirsten's approach to supplementation, which I noticed was, I mean, there's little doubt that vitamin D, magnesium, and K2 are probably okay, but I would worry about using supplements of calcium. I would prefer that calcium came through a whole food plant-based diet or through a whole food rather than as elemental supplements. There was a study in 2011 from Boland and Reed, and that was a meta-analysis actually. So a pretty reliable study from of 12,000 patients, which suggested that elemental calcium, which is usually in the form of calcium carbonate tablets, actually, if you take it, it disrupts the very narrow safety limit of calcium within the bloodstream, and in fact can go on to calcify your arterial walls or pass out as a renal stone. So I would generally be against calcium supplements of any kind, even if you're protecting it with vitamin D or K2. K2 is actually one other role of vitamin K2 is that it prevents this sort of ectopic calcification or calcification of the arterial walls, causing atheromas and infarctions. There was another study from the EPIC Heidelberg cohort. So EPIC studies are quite popular because they're European prospective trials into looking into cancer. And that again suggested that calcium supplements, which were thought to be a good idea initially for treating diabetes and hypertension, can in fact result in a higher heart attack rate. So that would be the only caution I would give against that. But if Kirsten's risk of getting further fractures is very high, then there is a role for one of these bone protection medications. But I think wearing a vest and going out for nature walks, as she was suggesting, is a very good idea still to go ahead with.
And would you recommend working out with weights as well in a situation like that for more upper body strength?
Yes, absolutely. I don't think there's any harm in working the bigger muscles of the lower limb in particular. So doing some kind of, strengthening exercise for the lower limbs. The Shazais actually recommend even a recliner bike for people who are of a low body weight. If they're strong, if they strengthen their leg muscles, they actually will benefit their bones overall. The risk of falls will also decrease. I think one of the effects of vitamin D is, again, that it seems to stimulate type 2 muscle fiber formation. So that's another important role which prevents falls, and it's known to be good for preventing falls in general.
I'm curious your commentary here about supplemental calcium, because earlier you talked about fortified plant milks, which I'm thinking, unless I'm mistaken, what they're really doing is adding supplemental calcium to the milk. Is that in some different form, or is it absorbed in some different way, or does it still have some of those same concerns?
No, in fact, fortifications are in much smaller quantities. And the fortification of, let's say, a plant-based milk, a soy milk, would usually be in the form of something called calcium citrate malate. And that is a gentler form of absorption. And the amount we use doesn't raise serum calcium to that extent. It's just a much lower amount, but well within that recommended daily allowance. Another really good source, for instance, is calcium set tofu. So as we know, tofu can be made in two different ways. So either you use a magnesium salt to precipitate the soya product in it. That's called a nigari set tofu. That doesn't have quite as much calcium as a calcium set tofu. And these are widely accepted as not affecting the serum levels of calcium to that dangerous extent as a pure calcium carbonate tablet or even a calcium citrate tablet can do. So that's what I would be against. I mean, in a sense, it's reductionism of a kind because you're taking out the so-called good element and just providing it in its by itself. We all know that whole foods are far better. And fortification is somewhat in between, probably more leaning towards the whole food rather than an elemental inclusion as we would get in a tablet form.
Got it. Thank you so much. That's very helpful. And it seems like part of the point is our bodies were designed to get foods and nutrients as part of a larger ecosystem rather than in a huge concentration in one dose.
Exactly.
And science can produce really powerful supplements that give us this massive quantity, but in many cases, our bodies weren't really designed for that. And even though it may in theory boost our calcium levels, it can cause other unintended side effects. But when you have a smaller amount that's more spread out, as part of a whole food ecosystem, if you will, the body is much better able to absorb it. So that makes sense. Thank you.
That's very well put, Ocean. Yes, thank you.
Susan said, I have severe osteoporosis as well as a rare lymphoma that manifests on the skin. I'm very sensitive to many things. I'm currently dealing with a body rash triggered by a COVID vaccine. So far, I've had it for 3 months. My endocrinologist wants me to do a yearly infusion of Reclast, but I'm afraid to. I also have some arthritis and have had both knees replaced. I'm very active and plan to remain so. I'm 72 years old. Do you have any advice for me?
Okay, well, it sounds like quite a few things are going on here. So there's, it would be interesting to know whether Susan is on some medication, which I assume she is for the lymphoma, and that in itself can cause a lot of these problems. So for instance, a steroid that is commonly used in lymphomas would cause a secondary osteoporosis, as will a lot of other cytotoxic drugs. They would cause it. I presume also that Susan is already on a more healthful diet if she's attending the network program that we have today. So hopefully that aspect is taken care of. I think she should continue to remain as active as her knees will allow her to. Did you say she'd had her knees replaced, Ocean? Sorry, I missed that.
Yeah. What she said was she'd had both knees replaced.
Right. I would say that I guess her endocrinologist or whoever was treating her has really looked at the fact that maybe her risk element is really quite high of getting an osteoporotic fracture. And that's why he or she is recommending an infusion of Reclast every year. And I think that would certainly prevent the severity of the osteoporosis from resulting in a fracture. But I think there's no harm in still pursuing some lifestyle measures, such as wearing a weighted vest and going for walks, being as active as possible, and trying to do some of these exercises with expert advice from her therapist or her doctor. Yes.
Got it. Thank you so much for that. We heard from Guat, who said, I saw you with Chef AJ on YouTube, and you mentioned not being on bone drugs for more than 5 years due to side effects. Can you advise, how do I stop? Because I've been taking them continuously for 3.5 years. I've been eating plant-based foods for 3 months now.
The reason why it is recommended that we stop these, I think one of the earlier questions you had asked, Ocean, was whether I would be worried about using drugs. So one of the side effects of these drugs is that, as we discussed earlier, they really focus on the osteoclasts. So they stop osteoclastic activity, and as a result, some of the old bone remains. And we can actually make bones a little more brittle, even though the density may increase because bone's not taken away. You can get what are called atypical fractures, which are really much more difficult for us to treat. And because osteoclastic activity, so the activity of these cells that take away bone, is really important even in the healing process of bone, these fractures are difficult to repair. So even if we treat them with the surgical method, there's difficulty in getting the bones to heal. Therefore, everybody who's on these bone protection medications should really get a holiday, a period of a year or two after a period of 5 years at least. And I think it's best that this is discussed with your treating doctor, as long as you're aware of the fact that there would be dangers of these atypical fractures. Also, people, for instance, who are having poor dentition or loose teeth in their jaws can suffer with a condition called osteonecrosis, which is one of the side effects of a lot of these medications that suppress the osteoclastic activity, including Reclast, for instance, or one of the conventional alendronates. That's the class of drugs that inhibit the osteoclastic activity.
Got it. Thank you so much for that. Nina said, spinal stenosis is something I was not aware of until recently when my uncle was diagnosed. And then I heard about someone who was 25 years old who was also diagnosed. They were both told nothing can be done but surgery and that it's caused by aging. It must be more than that. And I heard others who had surgery and ended up paralyzed.
Right. Well, spinal stenosis, very simply put, is a narrowing of the space through which our spinal cord passes. Usually, it can occur in the lumbar spine, where it's called lumbar canal stenosis. The commonest cause, she's absolutely right, is in older people who get degenerative changes. Now, degenerative changes just mean that some of the bone from outside grows inwards. And that's because some of the joints, which are called facet joints, produce a greater amount of bone that grows inwards onto the nerves and compresses them. So it's a very painful condition. The 25-year-old, on the other hand, who was diagnosed to have spinal stenosis, has possibly what we call constitutional stenosis. And that is because some of the elements of their vertebrae have just not formed to the fullest extent. So people who are achondroplastics, for instance, people who have achondroplasia or dwarfism, they have shorter pedicles, so there's less room for the spinal cord, and they can manifest with symptoms quite early in life. 25 is unusual, but maybe also they have an element of what is called spondylolisthesis, in which one vertebra slips over another. And that could be a reason why there's a constriction in the space available for the nerves of the spinal cord. I think it's extraordinarily rare for paralysis to occur in surgery on the spinal cord. And I'm sorry if somebody has had that. It is a risk to operate around nerves, and sometimes nerves just don't like being handled in any way, and you can get paralysis, but it is extraordinarily rare. In general, surgery is gratifying. The specifics of her own case that she's talking about, it's very difficult to be sure of unless one looks at the clinical picture and the MRI scans and so on. But I wouldn't say that surgery is the only way of treating spinal stenosis. There are lots of symptoms that can be improved by epidural steroid injections. Again, that is medication, but sometimes you have to reduce the pain so that somebody can get on with exercise and strengthening their core muscles, which are protective for the spine. So core muscles, which we know are the muscles of the belly and the back, they support your spine and are essential in improving our posture and protecting the spinal cord. So sometimes the pain is so bad from spinal stenosis, especially if they're getting sciatica or pain going down the legs, that it is worth using one of these methods, such as an injectable steroid, to calm things down so that one can participate in the rehabilitation process.
Would you think that a few alternative type of approaches come to mind, and I'm curious your take: chiropractic, acupuncture, and also taking turmeric and other anti-inflammatories?
Well, certainly an anti-inflammatory diet, one can't argue against a whole food plant-based diet that is largely anti-inflammatory. Again, even with turmeric, I would say it's better as a whole food rather than as a capsule or a supplement. So why not just enjoy it as part of your dietary process? So enjoy it as a whole food in a curry or whatever other form you were to have it. But those are certainly useful methods. And a lot of people would go to a chiropractor or an osteopath initially because they look at people much more holistically, actually, and can find simpler solutions. But without looking at the specifics of anybody's case, it's very difficult to advise somebody to go to an alternative practitioner. But I certainly have great faith in a lot of them. They seem to make a difference to the pain.
Yeah, thank you. Mary said, I've read that greens are an excellent source of plant-based calcium and vitamin K. How does cooking the greens impact these nutrients compared to eating them raw? And she also asked if the vitamin K in greens is K1 or K2. And of course, we know it's K1 in that case, which is actually really a different compound at the end of the day than K2, though they have the same sort of name in the alphabet. But what is your thought on raw versus cooked when it comes to calcium absorption?
I don't think it makes much of a difference really to calcium absorption. I think some things, if they you can, I really think it depends on preference. So if somebody prefers to eat their greens raw, so be it. It doesn't really affect the nutrition. I mean, calcium as a mineral, it's not destroyed by cooking in any form. And nor is vitamin K destroyed by cooking it. So I think they're pretty safe in whatever form one prefers to consume their greens. But greens are an excellent source of so many nutrients that really, as long as you chew them properly and consume them in a smoothie, and chewing them in a salad, or taking them cooked, whatever method, they're all very good.
Thank you. Barbara is pointing out that oxalates, as well as phytates and other so-called anti-nutrients, can bind with calcium and reduce absorption. And she's saying that a lot of foods have oxalates. She's wondering if you have any advice on this. And also commenting that she seems to be one of the 30%, I'm not sure where that number comes from, who has heart reactions to vitamin K2 supplementation. So she's really looking for advice on how she can absorb her calcium while keeping her arteries and heart clean and safe.
I wouldn't worry too much about, as we discussed, the oxalates, which are they in certain types of greens, like spinach is a high oxalate green, as a Swiss chard. Probably she should look at the other forms, the other greens such as kale, bok choy, cabbage. Those are forms that have a much lower oxalate content, and you can absorb the calcium quite well from them. As we discussed earlier, soybean, for instance, which I think is really a superfood and unfortunately has oftentimes received bad press, but it is really a food that is high in phytates and oxalates, but yet the calcium from it is absorbed just as well as it is absorbed from cow's milk. So about 30%, 35% is easily absorbed. So those are foods that I would certainly recommend to in this situation to Barbara.
Great, thank you so much for that. And I would also add, sprouting and fermenting can reduce oxalates and other anti-nutrient contents considerably. So, for example, with legumes, we always, in our house, we soak them for 48 hours, pouring out the water every 12 before we pressure cook them. And that slashes the anti-nutrient levels. So then you get more bioavailability of all the wonderful goodness that's in those legumes after that process. And so that can be helpful. Fermentation is fabulous as well. Proper cooking obviously helps too. So that's a place where raw isn't always best in some cases. And then as you mentioned, really it's the cruciferous vegetables, I think, that have the best sort of most favorable calcium to oxalate ratio, because you do have a lot of calcium in spinach, but you're not going to absorb that much of it because of the oxalates in there. Same with Swiss chard, but with cabbage and kale and collards and bok choy and so forth,
broccoli,
and broccoli, exactly. You get a wonderful ratio there. Alice said, how important is an alkaline diet for building bone strength? This is a common thought that eating alkalizing foods or alkaline rich foods is good for bone strength. Do you think that's a factor we should be looking at, or is it sort of that a lot of the so-called alkalizing foods are healthy for other reasons and alkalinity isn't really the point?
Yes, I mean, I think the better way of describing it is really a whole food plant-based diet. I mean, that is, in general, consuming foods that, are less acidic, so to speak. But I think the term alkaline diets are more often thought of as being a fat diet. So I would say a diet rich in fruit and vegetables in particular. In fact, there was a Chinese study which looked at fruit and vegetables, and they felt that fruit in general is greater for bone formation, so is better for bone formation. Certainly the alkaline milieu, I mean, our blood pH is around 7.4, so it's more alkaline. Yes, there are a lot of buffers for acidic foods that one may consume, and a lot of proteins are, in fact, on the acidic spectrum. But nonetheless, fruit and vegetables definitely are promotive of bone formation. Specific fruit, I suppose one would have to give a shout out to prunes, which are good for elderly people also because it helps with their constipation. But it also has a lot of phenolics and a carbohydrate called inositol, which are really quite good for osteoporosis. So, but any amount of fruit and vegetable, really, the more the variety, the better it is for bone formation.
Thank you so much for that. We heard from Nikki, who said, I fractured 3 vertebrae a year ago. I had the cement procedure. Now my ribs and back still hurt. Seems like a couple ribs are not stable. I'm using Garden of Life Grow Bones supplement, and my bone density has increased by 50%. Please suggest what I could do to eliminate the pain or at least lessen it. Are there any safe exercises I could be doing?
I'm sorry to hear that she's still in pain, but this sometimes happens, and it may be a variety of factors, but predominantly is the drugs that are used to prevent the osteoclastic activity that somehow result in some amount of residual pain. I think if the first thing I would say is, as long as it's not causing any further fractures, try and remain as active as possible. Any amount of exercise, certainly of a low or moderate intensity and frequency of going out, is really quite good for the bones. But also a simple anti-inflammatory tablet, which you could take in conjunction with your physician, can often help this kind of deep-seated bone pain that sadly does seem to occur in people even who've had a cement augmentation procedure, which is commonly done for osteoporotic fractures of the vertebrae. But the fact that she had 3 or more fractures, I think, is indicative that the osteoporosis was really quite bad. So she probably does need to remain on the medication, but probably adding an anti-inflammatory tablet will just ease that pain a little.
Got it. Thank you so much. Barbara asked, what is your opinion of vibrational plates for someone who had a compression fracture 10 years ago and has advanced osteoporosis, but still remains active and seems unimpaired?
Vibration tools haven't been studied very well in adults, but there's in humans, I would say, but there's still good evidence to suggest that a high frequency but a low amplitude vibration, whole body vibration device is really quite useful, as long as the pressures that the body is subjected to are not in excess of 1 G. So in other words, the normal, the higher the frequency, the better it is, but as long as it's low amplitude. And that will stimulate the osteoblasts. So there is probably a role even in severe osteoporosis, but it's better to make sure that you start with a low amplitude of a vibration device. Sometimes using simple exercise tools on top of the vibration device that you're using to stand on the vibration platform. So doing stacked exercises with light weights or resistance bands can actually help with muscle strengthening as well as your bones being stronger.
Thank you so much. Now, as we move towards closing, I want to ask you a more big picture question. Dr. Bajekal, why do you love what you do?
I think the gratifying thing about what I do, which is a kind of holistic way of practicing what I do as a surgeon and integrating it with my lifestyle medicine, as well as my knowledge of nutrition now that I've got my lifestyle medicine qualification, makes it such a fantastic opportunity to treat a wider range of patients. I mean, it's a bit like suddenly doors have opened at this late stage in my career. I wish I'd discovered it much earlier, because I think it makes for a much more complete doctor if you can advise people on a variety of things. Actually, people who come to me don't necessarily come to me for an operation. They come to me because they want to get better. And if I can give them, I mean, I think very few people want to have a spinal surgeon operate on them. I think there has to be some, backache is hideously common. We know that, it's the commonest cause of morbidity in the entire world. About 80% of people will get back problems at some point, and we alluded to that earlier. It's because of our more sedentary lifestyles that we have nowadays, possibly because of the Industrial Revolution and so on. So I think if the fact that I can see quite dramatic results on a day-to-day basis by just offering people the right tools to deal with their problems, and sometimes being able to do it by a simpler procedure than what the patient has anticipated, namely with an injection or a relatively small operation, or sometimes just with lifestyle advice, I think it's a fantastic position to be in, where I can make people smile from being in terrible pain. And that's what gives me a lot of joy.
I mean, how wonderful. Making people smile when they've been in terrible pain, helping people find relief. And so many people, I think, are looking for the best of both worlds. I mean, they want to implement lifestyle first. They want to do the right thing so that they can prevent illness, and so they can shore up the foundation rather than just treating symptoms. But they also want to work with somebody who understands the physiology, who understands the mechanics, and who can address it at a physical intervention level when necessary, and knows the difference between when that's needed and when it isn't. So your caution, your care, and your ability to really use the best of complementary and alternative approaches, and most of all, to focus on helping your patients get well, not just get out of symptom, but get well, is so inspiring. So we thank you so much for your leadership, for your example, for your wisdom, and for your partnership in the food revolution. It's been an honor and a privilege to spend this time with you.
Thank you very much, Ocean. I've enjoyed our conversation.
When it comes to cancer, Alzheimer's, diabetes, heart disease, and other chronic illness, what really matters isn't how many books you read, how many webinars you attend, or how much you know. What really matters at the end of the day is what you eat and how you live. The science has given us what we need to know. Now it's time for action. It's time to implement and optimize your healthy lifestyle. It's time to get results. It's time to say goodbye to confusion and hello to clarity. It's time to say goodbye to bad habits and hello to good ones. It's time to fall in love with foods that love you back. It's time to join a community that will support you in achieving your goals. It's time for Whole Life Club.